Have you ever wondered how medications like Mounjaro, Wegovy, or Ozempic help people drop significant amounts of weight, sometimes even more than with diet and exercise alone? Here's a crazy stat. According to a recent study, people on these medications lost up to 15 to 20% of their body weight on average, which is similar to what we see after bariatric surgery. That's huge! In today's video, we're gonna break down exactly how these GLP-1 medications work and how they were originally designed for diabetes but became a breakthrough for weight loss. We will also explore the differences between Mounjaro, Wegovy, and Ozempic and learn whether these medications are really the magic solution they seem to be, or if there's more you need to know before considering them. And stick around until the end because I'll share a surprising tip about what you can do to stay on track and achieve your weight loss goals. Hi there, I'm Nicole, PhD in natural medicine and a board-certified holistic health practitioner. I spend a lot of time helping people understand the science behind health trends, especially the ones making headlines, and how to discern what truly supports long-term wellness. If you've been curious about GLP-1 medications like Mounjaro, Wegovy, and Ozempic, you're in the right place. Now let's set the stage. Over the past couple of years, you've probably noticed how much buzz these medications are getting. Celebrities, influencers, and even common people are sharing dramatic before and after photos. But here's the thing. With all the hype comes a lot of confusion. Are these medications safe? How do they work? What's the difference between them? And most importantly, are they really the solution for long-term weight management and diabetes control, or just another short-term fix? That's exactly what we're going to explore. Okay, let's start at the beginning. GLP-1 stands for glucagon-like peptide 1. Sounds intimidating, right? But in simple terms, GLP-1 is actually a natural hormone that your body makes in your gut every time you eat. Think of it as your body's way of saying, hey, food is coming, let's get things in order. GLP-1 has three main jobs. One, it tells your pancreas to release insulin when blood sugar rises. Two, it slows down how quickly your stomach empties food so you feel fuller longer. Three, it signals your brain that you've had enough to eat. The problem is, in patients with type 2 diabetes or obesity, this system doesn't always work as effectively. That's where GLP-1 medications come in. Scientists figured out how to make drugs that mimic GLP-1, thus basically tricking the body into acting like it's got more of this hormone. This helps control blood sugar levels and reduces appetite. So when we talk about Mounjaro, Wegovy, and Ozempic, we're talking about medications that copy or enhance this natural hormone process. For diabetes, GLP-1 medications help lower blood sugar in a very clever way. They only tell your pancreas to release insulin when your blood sugar is high, not when it's normal. That means they're much less likely to cause dangerous low blood sugar episodes compared to older diabetes drugs. For weight loss, the magic happens in two ways. First, these medications delay gastric emptying and slow down digestion. So the food you eat remains in your stomach for longer, keeping you feeling full. You can imagine this as eating a meal. And instead of feeling hungry again in just 2 hours, you keep feeling full and satisfied 4 or 5 hours later. Second, they directly act on the brain's appetite control center. People often say they just don't crave food the way they used to. In clinical trials, people on Wegovy lost an average of about 15% of their body weight over 68 weeks. With Mounjaro, the results were even higher, closer to 20% in some cases. That's not just a few pounds. That's life-changing for many patients, especially those struggling with health issues tied to obesity like high blood pressure, heart disease, or sleep apnea. But here's where honesty matters. These medications don't work like flipping a switch. They need to be combined with lifestyle changes, and the results vary. Some people lose a lot, others only a little. All right, and this is one of the biggest questions people ask. Let's clear it up. Ozempic was one of the first GLP-1 medications to get major attention. It's approved for type 2 diabetes. However, it is often used off-label for weight loss. Its active ingredient is semaglutide. Wegovy also contains the same active ingredient, semaglutide, but at a higher dose. It is specifically approved for weight loss. So when you hear Wegovy, think weight loss version of Ozempic. Now Mounjaro is a little different. Its generic name is tirzepatide. Tirzepatide doesn't just mimic GLP-1, it also mimics another hormone called GIP, which plays a role in insulin release and fat metabolism. That's why Mounjaro has been showing even stronger weight loss results than Wegovy in some studies. So in short, Ozempic is for diabetes and is sometimes used off-label for weight loss. Wegovy contains a higher dose of semaglutide and is officially approved for weight loss. Mounjaro has a dual action, GLP-1 plus GIP, showing more weight loss, but it is still relatively new. Now, let's talk reality. These medications aren't magic, and they come with side effects. The most common side effects are nausea, vomiting, diarrhea, or constipation, especially when people first start a medication or increase their dose. Some describe it as feeling like motion sickness or morning sickness. There are also more serious but rare risks like pancreatitis or gallbladder issues. And if you have a history of a certain type of thyroid cancer, these drugs are not recommended. Another big challenge, cost. Without insurance, these medications can run over $500 per month. That's a major barrier for many people. Also, insurance doesn't always cover them, especially for weight loss alone. And here's the kicker. If you stop taking the medication, most people regain the weight. Studies show that once the appetite-suppressing effect wears off, old habits and metabolic patterns creep back in. That doesn't mean they don't work. It just means they usually require a long-term commitment and should not be seen as a short-term fix. So should you consider Mounjaro, Wegovy, or Ozempic? If you have type 2 diabetes and struggle with weight, these medications can be a game changer, not only for controlling blood sugar, but also for reducing your risk of heart disease. If you're someone who's tried diet and exercise for years without success, they may provide the extra boost you need. But if you're looking for a quick fix, or if you're not ready for the possibility of being on a medication long term, it's important to pause and reflect. These are prescription medications with real risks and real costs. Doctors usually recommend them for people with a BMI over 30 or over 27 if they also have weight-related conditions like diabetes, high blood pressure, or sleep apnea. Your doctor will ask about your medical history to determine if you are a suitable candidate to use GLP-1 medications and prescribe the right one. Your doctor will also suggest a treatment plan that typically involves gradually increasing the dose until you attain a maintenance dose. Your doctor may suggest alternative treatments if they feel these medications are contraindicated for your condition. So here's the big takeaway, the aha moment. GLP-1 medication like Mounjaro, Wegovy, and Ozempic aren't magic pills, but they are surely one of the biggest medical breakthroughs we've seen in treating both diabetes and obesity. For the first time in the history of medical science, people who've struggled for years with weight loss and blood sugar control finally have a tool that works with their body instead of against it. That's the real game changer. These medications shift the playing field, giving you a fighting chance where before it often felt impossible. And here's that bonus I promised. If you decide to start one of these medications, keep a simple food and symptom journal. Nothing fancy, just jot down what you ate, how hungry you felt, and any side effects like nausea or bloating. Why does this matter? Because everyone responds differently, and this little journal can help you and your doctor fine-tune your treatment. It's an easy, practical hack that can make the medication more effective and help you feel in control of the process. Let's quickly recap. GLP-1 medications mimic natural hormones to help control hunger, blood sugar, and weight. Wegovy and Ozempic are both semaglutide, while Mounjaro is a dual-action medication with even stronger results in studies. They can be life-changing, but they also come with side effects, costs, and the reality that they often work best as long-term treatments when combined with healthy lifestyle habits. If this video helped you gain clarity, please hit that like button, subscribe for more honest health breakdowns. Share this with someone who's curious about these medications and tell me in the comments. What's your biggest question about GLP-1s? I will try to cover it in my next video. Thank you for watching this. Be well and be kind.